have almost 80 witnesses who are scheduled to testify at this hearing, and we're going to hear from some of the supporters of the hearing, but first we're going to hear from Assemblyman Richard Gottfried, the original sponsor of the bill, who's been working on this issue for about 2 decades. Let's welcome Assemblyman Gottfried.
Well, good morning. Sorry we're getting started late, especially since we have about 80 people signed up to testify, which, by the way, is just about twice the number of witnesses that we have ever had at a Health Committee hearing in the 27 years that I've chaired this committee, and probably even further back than that. And first, I also want to thank NYU for hosting us here today. The New York Health Act would provide universal health coverage for every New Yorker. And by taking insurance companies out of the picture, it would save all New Yorkers over $20 billion a year, money that we would now be able to spend on our families, on creating jobs, and on strengthening our economy. It would mean equal opportunity for life-sustaining health care and for family financial stability for every New Yorker. Universal health coverage would remove barriers to health care, would enable each and every one of us to take control of our health care and to take responsibility for our health care. The Affordable Care Act has certainly made improvements, but its fundamental flaw is that it leaves us in the hands of insurance companies. And that means rising premiums. It means out-of-sight deductibles and co-pays that are, and limited provider networks that are with out-of-network charges that are real barriers to people getting the health care they need, real barriers to people being able to maintain their family finances. Employers are increasingly shifting the cost of employment-based health coverage to their employees, who can really not afford to pay it, or they are dropping health coverage entirely. Insurance company administrative overhead and profits, combined with what healthcare providers have to charge us for the time and staff that they spend dealing with those insurance company administrators, together take over 20% of the healthcare dollar. Take that 20% out of our pockets, out of our economy. And the only ones who benefit are the insurance companies. Clearly, New York State can and must do better. The New York Health Act, by providing universal, publicly accountable health coverage for every New Yorker, would take insurance companies out of the picture, would put billions of dollars back in our pockets, would end the regressive tax that we now pay to insurance companies in the form of premiums and deductibles and co-pays, regressive taxes that bear no relationship to ability to pay. Instead, health care for everyone would be accessible and would be funded by broad-based assessments that are based on ability to pay. What would this mean in particular for New York City taxpayers? New York City taxpayers now spend over $5 billion a year on public employee health benefits. And New York City, like every employer, would be saving a huge chunk of that $5 billion if the New York Health Act were law. New York City taxpayers now spend over $5 billion to help pay for the local share of the Medicaid program under the New York Health Act. There would be no more local share of Medicaid imposed on city taxpayers. And so that would be over $5 billion taken off the top of New York City's budget right off the bat. Money that could be used for schools, for police, for fire, for tax cuts for New Yorkers. And we'd probably also save about $1 billion in what we now pay to insurance companies as part of public employee health benefits. This is the fourth of 6 hearings we are holding around the state. We've already been in Syracuse and Rochester and Buffalo. What we heard at all of those hearings was story after story of people, even with health insurance, who face real barriers to the health care they need to protect their health and life, who face real devastation in their family finances because of the gaps in their coverage. We've been hearing from doctors who cannot provide the health care to their patients that they know they should because there's no way for their patient to pay for it, and there are limits to what doctors can do out of the kindness of their heart. And we have heard from small businesses around the state that want to do the right thing by the owner of the company and by their employees, but who find it harder and harder, if not impossible, to do that. These stories have been very difficult for me to listen to, but I believe they show that as a state, as a community, as a family, New York can and must do better. Thank you.